A condition whereby a baby stops growing in the womb or the baby is smaller than expected is known as fetal growth restriction. And this happens when there is a problem with the placenta, because the placenta is known to deliver the necessary nutrients to the baby, the oxygen for the normal growth. So when there is a problem with the placenta, this will restrict the flow of the necessary nutrients that are required for the normal growth of the baby. And this can also happen when there is infection. So I'm going to be telling you some of the things that can put the baby at risk of having FGR, that is fetal growth restriction. Number one is if you have heavy complication in the pregnancy, that is in the early pregnancy, most especially when there is bleeding. That can put the child at risk of having fetal growth restriction. Number two is when the mother smokes or drinks alcohol. Number three is when the mother is having some underlying medical conditions like high blood pressure, diabetes. Number five is when the mother has a previous stillbirth or a small baby. This can put the present child of having fetal growth restriction. If you have any bleeding during pregnancy, it is very important for you to get it checked out by your healthcare provider. What does fetal growth restriction mean for my baby? If your baby has fetal growth restriction, there is an increased risk of having complications during pregnancy. Sadly to say, there might be stillbirth. That is why you need your healthcare provider to monitor you throughout this journey. Can I do anything to reduce this risk? Yes, there are some things you can do to reduce the risk. Number one is to stop smoking. Number two is to take vitamin D. Number three is to take healthy balanced diet. Number four is to stop drinking alcohol. Number five is to reduce your caffeine intake, because this has led to so many stillbirths and complications during pregnancy. What do I do if I am worried that my bump isn't getting bigger? You shouldn't be worried about that, because all pregnant women have different sizes of bumps and shapes. So you shouldn't be worried about that. But in case you are more concerned about this issue, you can visit your healthcare provider and it will give you the best answer to that. If you find this video very helpful, keep liking and sharing this video for the benefit of others. And you can also subscribe to my YouTube channel at Nurse Emetuobi. Please don't forget to do this. Thank you so much.